Have you ever had shoulder pain which comes on when you try to lift your arm up or to try reaching behind your back? Or a shoulder pain that has been niggling you from time to time, on and off, without any history of trauma or injury to your shoulders? You may have a condition called shoulder impingement. Hi, I'm Dr. Vinod Kumar. I am an orthopedic surgeon. I specialize in upper limb problems and sports injuries. I'm also a certified professional fitness trainer. Stick with me for this video and I'll tell you a bit more about this condition. Now, to know about this condition, we need to know that the shoulder is the ball and socket joint, and it is formed by the arm bone, which forms the top of the arm bone, which is the ball, and then you have the socket, which is the part of the shoulder blade, which is the bone that you have behind your shoulder. Also, what forms the part of the shoulder blade is the roof of your shoulder, which is called the acromion, which is the bone that you can feel here, which is the flat bone here. So you have a group of muscles called the rotator cuff muscles, which sort of center the ball in the socket. And these group of muscles are in a tiny space between the roof of your shoulder and the top end of your arm bone, and that space is called the subacromial space. So anything which causes the arm bone to ride up or the roof to slide down will narrow that particular space. To better understand this, let me show you a model of the shoulder. So this is what I'm talking about. So you have the arm bone, you have the ball at the top, and then you have the roof of the shoulder. So anything which causes the roof to bend forward like that, like so, or the arm bone to ride up in that direction will pinch these muscles which are in between the roof and the bone, and this syndrome or this condition is called shoulder impingement. So what causes this problem? Nowadays we spend a lot of time using our mobile devices, laptops, tablets, or even looking at the computer screen or the TV screen. So what happens naturally is that we have a protracted or a hunch forward position with a weakness, which happens due to a weakness of the muscles which support your shoulder blade, and also weakness of the muscles which are deep inside the shoulder called the rotator cuff. This leads to the same problem that we talked about earlier, which is riding up of the arm bone when you lift your arm up, and also the sliding down of the roof of your shoulder, which pinches the muscle in between. So what are the things that we can do to try and mitigate this problem? So one of the things that you can do is to strengthen up your periscapular muscles, which is the muscles which are around the back of your shoulder, which tries to improve the posture. So instead of having a hunched to forward posture, if you have a normal, a retracted posture of your shoulder blade, then it reduces the chance of impingement happening. Also, if you strengthen the deep muscles inside your shoulder, which are called the rotator cuff, then this will prevent the arm bone from riding up and thus again pinching the muscles. So a combination of improving your posture, strengthening the periscapular muscles behind your shoulder, and strengthening the rotator cuff muscles inside your shoulder, these will help in mitigating these problems. Now, of course, not all shoulder pain is shoulder impingement. So if you do have a shoulder pain, you may want to first get it checked out by a competent orthopedic surgeon. And then if this is a problem, then you could try the exercises to try and improve things which I mentioned before. So if you like this video, do subscribe, give us a thumbs up, and press the bell notification icon so that you get notified of any new videos which come out, which will come in the following few weeks, which will help you to know about common orthopedic conditions and give you a quick loadout on what conditions happen with regards to various parts of the body. So I'm Dr. Vinod here, signing off. Until next time, stay healthy, keep fit, and have a good day.